Welcome back. We're going to take a live look right now over the Vatican City as many are continuing to mourn the death of Pope Francis. The Vatican announced his passing early Monday morning, and later in the day they released the cause.
Yeah, here to talk a little bit more about this is our medical expert, Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning.
What do we know about the Pope's cause of death?
Well, what a loss, first of all, right, for the Catholic worshipers. So what we know, Jordan, is that he blessed the worshipers on Sunday, on Easter Sunday, from his wheelchair. The next morning he woke up, had a stroke, and then about an hour later passed away. And the death certificate says that he slipped into a coma and then had a cardiac arrest. So if you think about strokes, and I don't know which type the Pope actually had, there's two types. One is called ischemic, which is from a blockage. So a blood vessel going to the brain has blockage in blood flow, and that causes brain damage. The second is called hemorrhagic, where the blood vessel pops. You actually get bleeding into the brain, and that causes damage to the brain tissue. Both of those can actually lead to complications with the heart. Certainly, depending on which blood vessel is involved, how big it is, that'll determine the impact of the stroke.
He's had a lot of health problems as of recently. Talk a little bit about his medical history.
Yep, so when he was only 21 years old, he had part of his right lung removed from a lung infection. And after that, he had sort of repeated lung infections. We know he had his gallbladder removed. He's had a lot of hernia surgeries. He had a surgery for something called diverticulitis, which is an outpouching of the colon. But as he got older, and he was 88 when he passed, he started developing a lot of the diseases of old age, high blood pressure and diabetes. And we know during his recent hospitalization, he even had problems with his kidney function as well.
You mentioned his high blood pressure and diabetes. How did that increase his risk of a stroke?
I mean, those are the two biggest target signs when it comes to stroke. In fact, patients who have diabetes have a 5 times higher risk of dying of some kind of cardiovascular disease. And essentially what happens when you have high blood pressure, the pressure inside the arteries is so high. So if you talk about damage to the arteries, either from bleed or from a blockage, that high pressure damages them over the years, and the diabetes makes them really sticky. So you get cholesterol deposits, you get weakening of the blood vessel wall, you get inflammation. So those are probably the two biggest risk factors that he had, but also his recent respiratory infection, because sometimes a respiratory infection, such as COVID, for example, can actually trigger a clotting phenomena in the body where you can be higher risk for stroke afterwards.
We know that even when he was in the hospital, he was doing things as Pope, and then we know that on Easter Sunday he also had an event as well. Do you think that he maybe didn't scale back enough to heal?
I do think that. In fact, his doctors had said when he left the hospital, because he was in the hospital for 38 days or something, that he should be essentially on bed rest, right, until he completely heals, especially at the age of 88 with a double lung pneumonia.
Right.
But, you know, as a Pope, there's a tremendous amount of responsibility, not just the travel, not just the events, but people count on you to be a moral leader as well. So I think the stress of being the Pope at the age of 88 after yourself struggling with your health problems and somebody who has chronic lung issues, it all just became too much.
And we've talked with you many times before on this show about how stress can really affect your health, even if you are a healthy person.
Very much so, and especially so, I think, at an older age, but even young, healthy people. Stress is one of the biggest drivers of disease, we're realizing. In fact, we call it a pillar of health. And unfortunately, for most of us, we live at a level of stress up here. So we're certainly going to miss the Pope, and, you know, finding his replacement will be interesting. We know that popes tend to be older when they're selected.
Right.
And so that's partly what sets them up, I think, to have more sort of chronic stress as well.
Yeah, we know we are in a period of mourning now. We know that the funeral is going to be on this Saturday, and then we're going to see who his successor will be after that. Dr. Kohli, thank you.
And a reminder, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.